This is the first part in the series on systematic review and meta-analysis, and this will be taken by myself and two of our dynamic senior residents, Dr. Aditi Rathod and Dr. Chainika Viswas. So I'm going to begin by really talking about what a systematic review is. So whether a systematic review is a form of research or not, that is a big question. But many universities accept systematic review as a distinct form of research, and it can be taken up as a thesis for your post graduation or for your PhD. But you have to confirm with your universities. What this type of research does is like any other research, it tries to answer a specific research question. But here we are looking at multiple studies. So systematic review essentially is a study of studies. The unit of study in a systematic review is a study. So it is done in a number of steps in which we first identify the studies which are eligible to answer our research question. We assess their quality, and then we try to synthesize the results which have been reported in these multiple studies. Now, this has to be done, as the name suggests, very, very systematically. What does this systematically mean? There are many steps which you need to follow carefully, and you need to use explicit criteria in a very transparent and replicable form so that if anyone else tries to do a similar study, they will also end up with the same results. The ultimate objective is that you conduct your research with minimum bias and error. And that is what we are going to try and understand, that when we are synthesizing the results, when we're looking at multiple studies, how can we do it in such a fashion that the scientific community is confident about our results, that it is replicable, that it is reliable, that it is valid, and there is not much bias and error in our research per se. So what a systematic review is, it is looking at multiple studies and it is trying to bring in one place the results of multiple studies. I'm sure you all know a little bit about systematic review. So why do we do such type of research? The ultimate objective, of course, is to synthesize evidence. So there is a vast quantity of primary research out there, and an up-to-date summary of those results is needed to come up with a decision. So it is important for decision making that you synthesize the results which has been reported in multiple studies. Now, the decisions which we take should be evidence-based, and systematic review helps us to do exactly that. That is, make our decisions evidence-based, be it for policy making, be it for clinical practice, for program design, or even for your research. So for policy practice, it is very obvious that supposing there are results which are reporting say association in either direction. Some are saying there is an association between two variables. Some are saying there is no association. So there is a lot of confusion and controversy. In such situations, systematic review will help you to pool the results, to come up with pooled estimates, and to make a decision as to what the true effect could be. Similar scenario could arise for practice, but what happens in research? So in research, what are the endpoints in systematic review? One is that your systematic review may end saying that there is plenty of research of good quality. We have got a solid pooled estimate, so no need of doing further research. Another could be that there are not many studies and there is need to do more research on this topic. And the third could be that there are studies on this topic, but they're of poor quality. And these are a few reasons why we say they're of poor quality. So when in future research is done on this topic, one needs to address these points of bias and use a more robust design in future research. So this is the endpoint in a systematic review, which gives us further direction, not only for policy practice, but also for research. So are you with me till here?
Yes, ma'am.
Yeah, I can see that some 12, so at least 9 of you all have joined. So if you have any questions, please keep asking us. So what we have seen is what is the definition and what is the purpose. Why do we do systematic reviews? Now, this is an example of a forest plot which we are all interested in drawing at the end of a systematic review. I'm showing this at the beginning just to illustrate that there could be innumerable studies which report their findings which could be different from each other. And what you do in a systematic review and meta-analysis is to pool the results. So each individual line, horizontal line, is an individual study, and the diamond which you see at the end is essentially the pooled estimate. So this is the pooled estimate, and these are the individual studies. And your systematic review and meta-analysis has helped you to pool the results together and give you an estimate based on which you can make your decision. This is an example of the use of corticosteroids for managing tuberculous meningitis. So you can see that in many of these studies where the squares, the blue colored squares are to the left, there is a beneficial effect of steroids in this particular clinical presentation, but there is a study where it appears that it could be more harmful. But when you pool the results, you are able to come up with a evidence-based decision that you can prescribe corticosteroids for managing tuberculosis. And as you can see, the outcome here, it will help you reduce death and disabling neurological deficit. This kind of systematic review was used by World Health Organization to come up with a guideline for using corticosteroids for managing tuberculous meningitis. So this is the power of the SRMA. This is what you need to understand. Now, why we decided to take up this topic is that in our department, we were able to publish these 3 SRMAs, and we wanted to share our experience and the steps which we undertook, which helped us to go ahead with our publication. So I'm sure that some of these points will be helpful to many of you all when you take up your SRMAs. Now, of course, when you see these SRMAs, there are different types. In the first type of SRMA, we were looking at what is known as heterogeneity, which can be captured in an SRMA. The second SRMA is looking at the effect of an intervention on an outcome. And the third SRMA was looking at the prevalence of cutaneous manifestations. So there are different types of SRMAs which we need to understand, which we'll see in the coming slides. Now, as I told you, SRMAs consist of a number of steps. So the first step is problem formulation, that is identifying your research question and the scope of your study. Based on that, you decide your search strategy and the database which you want to search, which is searching the literature. Once you get to the literature, means you get number of studies through your search. You have to find out of those many studies which you have landed up with, how many are actually eligible to answer your research question. Once you finalize that, you extract the data from these studies and do a critical appraisal in terms of the risk of bias in each studies. Then you choose the studies which can be taken up for meta-analysis and do meta-analysis, which is applying statistical techniques to the data which you have collected from multiple studies. You report the results of your meta-analysis. There is something also known as a living meta-analysis, means you have published your meta-analysis and you put the system on alert that any other study, if it is published in the future on a similar topic, you should be alerted. You will go through such articles, and if you feel they are eligible for your research question, you update your systematic review and again republish it. That is known as a living SRMA. So you can see that you go up the step and then you can repeat the entire process if you get new studies in the future on similar topic. Another important point which you can see here is that SRMA is teamwork. So it is not a solo domain. You have to work as a team. Minimum 3 people or 3 investigators are required to conduct an SRMA. And there should be individuals who are domain expert and methodological expert. Domain expert means a subject expert. So if I am doing a study on a topic which is related to, say, tuberculosis, I would want somebody from pulmonary medicine or who is working in tuberculosis as a domain expert. If I am taking up some dermatological manifestation, I would want a dermatologist to be in my team. A methodological expert means a person who is trained in SRMA or who is trained in epidemiology and biostatistics, who is able to read each and every article and is able to critically review the article, find out what kinds of biases are there, as well as extract the relevant data and do the statistical analysis required for meta-analysis. So it has to be a teamwork, right from identifying the research question to writing your manuscript, interpreting the data, and coming up with recommendations. Everything is a team work. So this is something which you should remember as far as SRMA is considered. Now, the first step in an SRMA is to formulate your problem, which is first identifying your research question. Now, this itself is a huge task. It takes a lot of time, a lot of discussion, engagement within your team as well as with experts. But this is the critical step. You need to spend a lot of time so that your effort does not go futile, because this is going to guide all the other steps in SRMA. Now, you must have heard about the final criteria in your BCBR workshops, which is that your question should be feasible, interesting, novel, ethical, and relevant. Ethical in SRMA, of course, you do not need to take the clearance from or approval from your institutional ethics committee. There is also a recent circular from ICMR which reiterates that ethical approval is not required, but the research question itself should not be unethical, mainly in the sense that it should not create or enhance any kinds of inequity in the society. So you should not focus in your research question on a particular group in the society, because ultimately then you will end up making recommendations for a particular group. And if you feel that is going to enhance or increase inequity, that would not be an appropriate research question. Another criteria which is mentioned in literature is a sample criteria. That is, your research question should not be ambiguous but specific, that it should be answerable, should not be dreamy or unanswerable at all. There should be measurable constructs, that is, whatever variables you are taking, those should be measurable and should have been measured with valid tools. It should be practical, means it should be used by policymaker, program implementers, or clinicians or researchers. It should be logical and empirical. There should have been studies conducted on that particular topic. Now, my suggestion based on our experiences, don't hunt for research questions using these criteria, but come up with 4 or 5 research questions based on your discussion with the team, with the experts. And then from amongst those questions, identify the ones which fulfill this criteria. So if you go using this method, it is more likely that you would land up with questions which fulfill the criteria as well as which are answerable and which can be used in the future. Now, I gave you some examples of the studies which we undertook. So there were 3 types of research questions out there. In fact, there were only 2 types. We had given a twist to one of the research questions. So 2 of our research questions were prevalence reviews. That means we were looking at the coverage of effective cataract surgery, and we were looking at the prevalence of cutaneous manifestations in chikungunya. So you can have prevalence or incidence surveys, or you can have effectiveness reviews. So one of our SRMA was an effectiveness review in which we were looking at the effectiveness of corticosteroids in lymph node tuberculosis. You can have etiology or risk reviews in which you are looking at associations of 2 variables, or you can have diagnostic test accuracy reviews in which you want to pool the validity of screening or diagnostic test. That is, you want pooled sensitivity, pooled specificity of the test, which has been reported in many studies. Or it can be qualitative review, mean experiential or review of a qualitative studies, which is also known as meta-synthesis. So SRMAs themselves can be of different types. That is the take-home message. One important point which you should remember is that when you're actually doing a study, you know that it would be difficult to do an effectiveness review. It requires more resources. You would have to do a RCT for an effectiveness study. Similarly, you would have to do a well-planned observational analytical study to establish etiology or identify risk factors, that is your case control cohort studies. And in the series of epidemiological studies, probably the easiest ones to do are the cross-sectional studies, which are the prevalent studies. But when you take up SRMAs, remember that you are looking at already published studies. So the effort which you put in will be the same, irrespective of the type of research question you take. So my main, um, you know, suggestion is that do not be afraid to take up reduce for effectiveness. Effectiveness reduce will be where you're looking at already conducted, reported, or published RCTs. So these can be done if you know the steps very well. So be confident in taking up all kinds of SRMAs. Now this was one activity which we had taken up in the on-site session, but you can just go through it because here there are examples of all different types of the SRMAs. So if you try and identify which SRMA is the one which is going to be used for these research questions, it will make things more clear. However, here I'm just going to move ahead. Once you finalize your research question, the next thing is to come up with a single one-line objective. Supposing you are looking at effectiveness SRMS, the objective could be to assess the effect of the intervention with respect to the comparator for a particular health problem in a particular population of people with particular disease. So you have to be very clear with your objective. Once you develop your objective, the next step, so you can see that your research question helps you to formulate your objective. Your objective then helps you to articulate your PICO. So from your review objective, you develop a PICO. Now again in your BCBR, you have been taught about PICO. PICO is nothing but population, your participants or the problem of interest, the interventions, the comparisons, and the outcome. Sometimes you may have to specify the study designs you're interested in for your SRMA, so it becomes PICOs. So we just try and understand what we need to describe when we talk of PICOs. So P is your population, your participants, and your problem. So here, what you need to describe is your diseases or conditions of interest, wherein you should mention with explicit criteria what is it that you're interested in. The population you're interested in, what is the age, gender, or are you interested in specific subgroups like pregnant women or any specific setting like rural, urban, hospital, community-based, and your population characteristics, specific ones which you are interested in. Interventions, when you're describing your interventions are not always drugs. They could be vaccines, they could be different programs or even policies of interest or your IEC, intervention as an IEC module. Now here you also have to describe what is being delivered, who delivers it, how it is being delivered, where, when, and how much it is delivered, and what kinds of variations are acceptable in your SRMA. For comparisons, it could be that you are going to include studies which compare the specific intervention with a placebo, or you will also include studies which have no intervention or standard care, or is it that you're interested in studies which are comparing two different interventions? So that is something which you have to be very clear about. Now, in your outcomes, of course, the outcome measures per se, but also the timing when those measurements of those outcomes were done, and what exactly are the data sources. Is this self-reported outcome? Is it investigator reported outcome? Or is it lab outcome? Or is it from the records? So that you have to describe. And then, of course, study designs, because each kind of, your SRMA research question will require certain kinds of study design. So if it is an effectiveness SRMA, you will have to probably include the RCTs in your study. If it is the association SRMAs, observational studies would be acceptable. If you are doing your prevalence study, you would want to include the cross-sectional studies too in your SRMA. So you have to, in many cases, specify what kinds of study designs are going to be included in your SRMA. So you have to first start thinking what your PICOS framework is going to be for your SRMA. Now from the PICOS then comes your eligibility criteria. The PICOS itself, then when you ask yourself what are the kinds of studies I'm going to include or exclude for the PICOs. So for each of the PICOs domain, you have to specify your inclusion and exclusion criteria. Means in the population, what are you going to include? What kind of studies reporting what kind or done in what kind of population or what kind of diseases are you going to include and what are you going to exclude? What kinds of intervention you are going to include or exclude? Because this kind of clarity will help you define the scope of your review, your search strategy, as well as when you are screening the studies and then data extraction. The steps which we are going to see in future are all being driven by PICOs. So you have to be again very careful and you have to come up with a table for the PICOs and the inclusion exclusion criteria because this becomes a part of your manuscript. So this is one of the supplementary tables which you report when you publish your SRMA. So this is an example of PICOs and then development of inclusion and exclusion criteria for this particular SRMA in which we are studying effectiveness of an intervention to improve adherence to antihypertensive medication among adults with hypertension. So the SMS reminders are the intervention. So what you can see is that we are specifying in the population whom we are going to include, exclude, what kind of interventions we are going to accept, which are the ones we do not want to include in our SRMAs. The comparator, what kind of comparator, whether if it is present in the primary study, I am going to include those studies. And similarly, the outcomes. So I am interested in studies which are reporting quantitative adherence. I am not going to include studies which report improvement in knowledge or satisfaction. I am interested in the randomized control trials. I am not going to include qualitative studies or observational studies. So your research question helps you to come up with an objective. The objective helps you to come up with the PICOs, and the PICOs help you to come up with your inclusion exclusion criteria. So are you with me till here? Are things clear till here?
Yes, ma'am.
Yeah. So once you know that this is what you want to do in your SRMA, what kind of studies you want to include and what kind of studies you want to exclude, the next thing is, so these are again a few examples. Like in our study, we wanted to look at the effect of corticosteroids on lymph node tuberculosis. So our research question which we framed was, in patients with lymph node tuberculosis, does adjunctive corticosteroid therapy improve treatment success rates compared to anti-TB therapy alone? Based on the research question, we framed our primary objective as to assess the effects of adjunctive corticosteroid therapy on the treatment outcomes in patients with lymph node TB. So what do you think will be the next step when we are going ahead with the SRMA? What will we do next? Supposing we have come up with the objective.
To frame the PICO criteria.
Correct. So we framed the PICOS criteria, right? So this was our PICOS in which we finalized the population. That is, we wanted to include patients diagnosed with lymph node tuberculosis. Our intervention was corticosteroids, which was given along with the standard anti-tubercular treatment. We wanted comparison as this treatment alone or without placebo. We identified very clearly what our primary outcome was, which was complete resolution. We mentioned secondary outcomes of interest. The time periods when this would be measured, that is what we were interested in, which we would include in each step of our SRMA. We would include both hospital-based, community-based studies. We were interested only in SRMAs and the studies which were published in English. So you can have some additional points to bring more clarity in your framework, PICOS framework for your further steps. So here you can see that we have included the time period, other criteria to make it more clear for further steps in the SRMA. So once you have your PICOS, you come up with your inclusion exclusion criteria in a tabular format, and you always keep this in mind in each and every step. Now, because it was an intervention study or effectiveness SRMA, we had the PICOS format. If it is association or risk review, It will be a PECOS format in which the intervention is replaced with the exposure. If it is a prevalence review, it is a COCO POP format, and if it is a qualitative research, it is a spider format. So the framework which you use depends upon the type of systematic review. That is something which you should know. Now, if you look at these research questions which are there, do you see any difference in the research questions? The first one is saying whether antiplatelet agents in general are effective in preventing all thrombotic events. To the right, it says aspirin to prevent risk of stroke in elderly persons with a history of previous stroke. The second one says corticosteroid injection, any tendonitis, corticosteroid injection to prevent shoulder tendonitis. Here it says any exercise for mental health, right? It says supervised running for depression. So what do you see any differences here?
The other side of the questions are more specific, ma'am.
Yeah, correct. So what you see is difference in the scope of the research question. To the left, it's very, very broad, and to the right, it is very, very narrow. So this is what you have to decide. When we say problem formulation, one aspect of problem formulation is to come up with the research question, but the second is to decide the scope. Now, in the scope, you can have a narrow research, the scope can be narrow, in which you are looking at a very specific question. But you will find very less number of studies when your scope is very narrow. The applicability of the findings may also be very narrow, but these kinds of SRMAs with a narrow scope are easier to do because there is less work involved. But when you keep a very broad scope, it means you are going to capture all the natural variations which are there and include all the patterns. So there is going to be a lot of heterogeneity in your studies. So an advantage is you may be able to analyze the heterogeneity. Heterogeneity itself could create a problem when you want to come up with pooled estimates. And because you're going to get large number of studies, more resources, more people, more time is going to be required to go through all those articles. So in your research questions, when you formulate a research question, you also have to decide the scope of your SRMA. You can narrow it down or you can broaden it up. This can be done by what is known as splitting or lumping. So splitting means you can split each and every component of your PICOs and make it more focused. Lumping means you can bring together different aspects of a domain and bring in greater variation to each of the PICOs domain and broaden the scope of your review. Now, if you understood this concept of scope of a review, can you broaden the scope of this review? Can you think you can broaden the scope of the review where the objective was to assess the effect of adjunctive corticosteroids in patients with lymph node tuberculosis? How can you broaden it? When I say broaden it, it means that you broaden either the population of interest, the interventions, or the outcomes. So here, what you can do is you can say that I want to study the effect of adjunctive corticosteroids, not just on lymph node tuberculosis, but on all extrapulmonary tuberculosis. So what I'm doing, I'm broadening my scope. I'm going to include more studies in this kind of systematic review as compared to just lymph node tuberculosis. Are you understanding this?
Yes, ma'am.
Supposing I want to narrow down the scope of this review, do you think I can narrow down the scope? So I can say that I want to study the effect of a specific corticosteroid, only prednisolone, in patients with lymph node tuberculosis. So I'm narrowing down the scope by narrowing down upon my intervention. Or I can say that I want to study the effect of adjunctive corticosteroids only in the pediatric age group. So I am narrowing down the scope for the PICOS ka P, that is the population of interest. So are you understanding that it is up to you whether you want to split and narrow down or whether you want to lump together different concepts and broaden the scope of your review? Are you getting this?
Yes, ma'am.
Yeah. Okay. So the next thing which we are going to do is, because one of the participants mentioned about this when they were registering, that they want to understand the process of registration. So each and every SRMA needs to be prospectively registered. Means before you take up your SRMA, you need to register it in Prospero. Now, this is a system which is hosted by National Institute for Health and Care Research in UK. And all you have to do is, first you have to register on the system. You have to join the Prospero, and then you have to log in and enter the details of the protocol of your SRMA. Now this prospective registration, that is registering before you begin your SRMA, is important because it reduces duplication of the effort, because somebody else may already have taken up the SRMA. In our experience, we have seen that we have come up with a number of research questions, but when we put the research question in Prospero, majority of the times it is seen that that research question is already being done or has already been done by another group. So it is important to try and check in the Prospero whether that research question already exists. It reduces wastage of efforts. It also promotes accountability, because you have to very clearly mention your methodology, what you're going to do in your protocol, which brings in rigor, ensures comprehensiveness, and also brings in transparency for your research. So when you're doing the Prospero registration, these are the few things which you need to mention. Right from the title of your SRMA to the details, the PICOS format, the eligibility criteria, when you want to start and end your SRMA, the full protocol, the steps which you are going to take up, who is going to do the searching, the screening, what are the databases you are going to access, what is going to be your search strategy, what are the variables on which you're going to extract the data, what tools you're going to do to look at the quality of study and assess the risk of primary studies, what are the outcomes you're interested in, and if you want to do a meta-analysis, what are the tools you're going to use, software you're going to use to do the analysis. What is the current stage of review? Because here you want to ensure that you have not begun your search prior to the registration. And then, of course, the other details which are mentioned on this slide. So all this, the protocol has to be ready, and then you have to go on the Prospero and enter the details and register your SRMA. So are you getting this? This is known as Prospero registration. This, remember, has to be mentioned in your manuscript very clearly, because you also have to not only give the registration number but also the link, so that the reviewer, the editor, goes and sees what you have registered and whether what you have published is in line with your protocol which you have published. So you have to be very careful here. Once you register in the Prospero, and if you make any changes or edits in the future, you have to update it in the Prospero too. This is another thing, because in our one of our SRMAs, we did make a change after our registration, but we went on the website and also updated the change in our protocol. So this is another thing which is very, very important, because it comes up in your manuscript. So are we clear with Prospero registration?
Yes, ma'am.
Now, the next thing what we are going to do is we are going to start with the search strategy. So we have finalized our research question, formulated our primary objective from the research question. Then we have designed our PICOS format and described the PICOS in detail, developed our inclusion exclusion criteria based on our PICOS. And this is the time to go and then plan everything else in the protocol, go on Prospero and do the registration process. Once we do the registration, the next thing is now we want to get the articles for our SRMA. And for this, we need to search databases. How to do the search and how to develop your what is known as a search strategy to reach to those articles. This is what will be the next presentation, which will be given by Dr. Aditi. So I will call upon Dr. Aditi to start her session on the search strategy and conducting